Hello, all. This is Dr. Kirti Narayan, consultant radiologist at BGS Global Gleneagles Hospital, Bangalore. Firstly, welcome you all to the session on radiology. In this session on radiology, we'll be discussing what this new branch of radiology is about, how to become a radiologist, what are the different pathways available in India and abroad, uh, what are the perks of being a radiologist, how is the work-life balance for a radiologist, what are the different subspecialties uh, available in radiology for further training, uh, how demanding is the branch, what are the opportunities for radiologists in India and abroad, what are the different pathways available for radiologists to move to different countries. So this session will introduce to you a lot of factors, a lot of things about radiology in a nutshell. Yeah. Okay, let's get started then. Firstly, this branch of radiology became popular in India after the advent of CT and MRI, which happened in the early 90s. Uh, so suddenly you had an explosion of all these new technologies coming into medical field like CT and MRI. You wanted a doctor who could read these scans and let you know what the findings were. So that is how this branch of radiology became popular. Right since 2000, this branch has been in great demand amongst doctors because this offers a great work-life balance and also an attractive compensation plan. Right. So let's quickly run you through what a day in radiologist's life is uh, about. So, firstly, radiology deals with mainly in India. We have to the job of radiologist is to do ultrasounds, report X-rays, CTs, MRIs, and also do a few image guided procedures like biopsy, drainage procedures. I'll speak about intervention radiology, which is an which is an offshoot of radiology a little later. But now let's concentrate on radiology proper. So basically, a radiologist's job is to do these do ultrasounds, report X-rays, CTs, MRIs, and you have to discuss with the clinicians. We are basically not as patient-facing department as other clinical specialties are, but then we are very important for the uh, clinician because we help him understand the nature of diseases that he's dealing with, make a proper diagnosis, and aid in the treatment of the patients. Right. Uh, I think most of the audience are still in the undergrad level, so I don't think they would be properly exposed to what radiology department is all about. So I would recommend that they do a couple of months of internship before they make up their mind about which specialty to choose, even if this were to be radiology, because of course the exposure to other specialties might be there in internship, but not much to radiology. Uh, right. So, what are the different pathways available to become a radiologist? In India, there are two, three different ways one can become a radiologist. Most people know that there is MD, which is the master's degree given from a medical college. Then there is DNB given by the National Board of Examinations, again, which is a master's degree. Also, a few hospitals in India are still providing diploma in radiology, which is a diplomate degree, which is a diploma degree. This is not equivalent to master's degree in that this course is only for 2 years and the master's degree would be for 3 years. Uh, and also master's degrees usually include a thesis, which is a research, program type. Right? So radiology is, a very, it's a extremely sought after specialty uh, in NEET PG, basically because this offers a very good work-life balance and and an attractive compensation plan as well, right? So, what are the different pathways one can become a radiologist abroad? Right, in UK you have a degree called as FRCR, which is a fellowship from the Royal College of Radiologists. So you need to do this degree to become a radiologist in UK, and USA has also separate fellowship programs to become a radiologist. So an Indian IMG, International Medical Graduate, can write PLAB or USA will move to these countries and do these fellowship programs to become a radiologist. That Alternatively, you can do an Indian, a master's degree, become a radiologist here, then write FRCR, which is accepted world over except for America. So once you've done the FRCR, then each of these countries have their own, you know, exams for certification of radiologists. So you could write any of these exams, like a DHA for Dubai Health Authority exam, uh, uh, then RANZER or AMC, Australian Medical Council exam to practice in Australia, New Zealand. And FRCR is good enough to practice in UK. So these are the various exams in different countries to start practicing radiology. If you have done your master's degree from India. Well, talking about work-life balance, uh, radiology is not like other clinical branches wherein you have to pull 24 hours, 36 hours, 48-hour shifts without a wink of sleep. Radiologists also need to do these shifts, but again, it is not as taxing as it is for clinical departments, because you're not really, patient-facing department like these departments are. Your job is mainly to aid these departments in doing their work. So while you're in a medical school, or you're doing your DNB program, it might be a little taxing in that you might have to do 24 hours, 36-hour shifts. But then it is not really as taxing as it is to a clinical department. Uh, you know, because despite doing all these shifts, you would still be not as stretched as these clinical departments are. And well, coming to compensation in India, unlike your clinical counterparts, you'd be starting at a much higher salary. Uh, like if you were to start in corporate setup, you'd be starting somewhere around 1.5, 1.6 as a fresher. In comparison with your clinical counterparts, would be starting probably at 80 or 80,000 or 1 lakh in India as registrars. Uh, Also, in medical colleges, everybody will be paid the same salary. Now you'll be starting a senior assistant in the medical colleges after your post graduation. You'll be starting as registrars in corporate hospitals, but then there isn't much salary discrepancy in medical college because it's a fixed slab for everybody. Whereas in corporate hospital, radiologists are paid slightly higher than their clinical counterparts. Mm, it takes about 3 to 5 years, anywhere between 3 to 5 years, to become an associate consultant or a consultant, wherein the salary is much higher and you would have year on year hike and all those perks of being a consultant come into play. In medical college, it takes about some in central institutes, it takes about 3 years of SRship, senior assistantship, to become an assistant professor. Whereas in uh, you know colleges maintained by the state government or private medical colleges, 1 year of SRship is enough to become an assistant professor. Uh, okay. For those radiologists who are practicing in tier 2 or tier 3 centers, smaller cities, towns, or even villages, the compensation or the earnings are exponentially higher in comparison to those who are practicing in metro cities or tier 1 cities. uh, you can look at a salary around 4 to 5 lakhs as a starter, as a fresher, in tier 2, tier 3 cities, even uh, particularly in Kerala and North India, Northeast India regions. Right. Talking about subspecialties available in radiology. Radiology for a very long time was thought to be an end specialty, in that you do a postgraduate degree and that would suffice for life. Not anymore. With rapid growth of other clinical departments, radiology has also uh, grown leaps and bounds. So we have multiple subspecialty training fellowship programs available in India and abroad. For example, you have fellowships in neuroradiology, musculoskeletal radiology, fetal medicine, pediatric radiology, abdominal and chest radiology, to name a few. Apart from this big booming subspecialty, which is threatening to become bigger than radiology itself, called the intervention radiology. So intervention radiologists are, for the starters, a new these people practice a new offshoot from radiology, which is oriented more towards clinics, in that they help in treatment of acute emergencies like strokes, GI bleeders, you know, uh, vascular thrombosis, plasties. So what they do is they take the patient to the cath lab, get into their arteries, and then they go to the area of uh, interest, and then they intervene in that area, release the block, or if there's a big bleeder there, they plug the vessel that is leaking. That is one of the few things they do, and it's coming up in a big way in India and abroad. And in the years to come, this will become much more bigger than what it is today. Again, such subspecialty training fellowships are available everywhere in India. It's coming up in big way in tier one, tier two cities. Now, DMs are coming up in radiology. There are DMs in intervention radiology, neuro intervention radiology in NIMHANS, AIMS, PGH Chandigarh, CMC Vellore, to name a few. SRM, Medical College Chennai, and scores and scores of other medical colleges and corporate hospitals offer intervention radiology fellowships, MSK, neuroradiology, multiple other fellowships are available. Well, if you want to try your hand in foreign fellowships, you can definitely go to UK, US, or other countries. In UK, you have to have FRCR degree to try your hand in those fellowships. Also, alternatively, other pathways are coming up. Like there are tie-ups between corporate hospital chains in India, like Apollo, Manipal, and NHS. So the doctors who are working within these chains of hospitals get to go to UK for a short period, like usually 2 to 3 years for further training under NHS, and also they get to work there in UK with the NHS. And upon completion of their training, they can choose either to come back to India or stay back in UK and continue working with NHS. So this program is called M-Med program, and there are types between these corporate chains and a few universities in UK. Alternatively, there's another program called MTI, Medical Training Initiative, wherein doctors from various different countries can get to go to UK and get trained in UK for a period of 2 years, and upon completion, you can choose whether or not to stay back in UK and work there. Also, if you want to give a try, uh, you can actually write USMLE after completion of your PG and then try American fellowships as well. Though it is harder to land than those fellowships in UK, uh, it is definitely worth a try. Also, there are research positions in America which are much easier to land if you have a research background in India. Well, the primary job of radiology is to serve the clinical departments, in that we help them understand their patients better, make a proper diagnosis, and then also aid them in the treatment of their patients. So, as and how the clinical specialties, subspecialties expand, there will be expansion in radiology as well. So, in the last 10, 15 years, we've seen that there have been rapid strides made in radiology, different branches that have come out in a big way, like MSK, musculoskeletal radiology, neuroradiology, intervention radiology was also, uh, a, you know, uh, one of the branches that came out in the last 10, 15 years in a big way. Though it was there in Europe for the last 20, 30 years, it was there in Europe. It has come out in a big way because now the cath labs are more uh, easily available in India, and the hardware used for intervention has become much cheaper. So uh, what we will see in radiology in the next 10, 15 years is there'll be rapid expansion and ramification of this department into much uh, smaller subspecialties. Radiology will invade everything possible because radiology most easily acceptable to technological changes. uh, in the last 5 years or so, there have been pioneering works about introducing artificial intelligence to radiology. It is still in testing stage, but it has definitely shown promise. So probably in the next 3 to 5 years, we might see AI coming into play in radiology, and hence the workload, the mundane workload for radiologists might decrease. But then So what we'll see in the next 3 to 5 years is that radiology might cease to be the broad specialty that it is called today, and might ramify into smaller subspecialties like musculoskeletal radiology, neuroradiology, and of course intervention radiology. So with the advent of AI, we will you know try percolate deeper into clinical specialties and also branch out into directly patient facing field as well. uh, Upon completion of one's training, one can choose to work either in India or abroad. I've already briefly touched upon, uh, uh, what compensations one can expect in India. If one were to shift base to UK or US or UAE, in UAE one can expect a starting. UAE requires you to have at least 2 to 3 years of experience post your post graduation. So once you have those required number of years of experience, what you can think about, if you think about moving to UAE or Middle East, sorry, you can expect a starting salary of about 8 to 9 lakhs Indian rupees without tax in UAE, whereas at the whereas if you wish to move to UK, you can expect a salary of around 4 to 5 lakhs Indian equivalent uh, under NHS as a specialist registrar. Upon becoming consultant, one can expect a salary of about 10 to 12 lakhs in the UK, and much higher, around 15 to 20 lakhs in UAE. So these are the job prospects in these countries. For those of you who have entrepreneurial genes, there's obviously this option of starting a diagnostic center or a lab, whereupon uh, you can make a great amount of money. Though the challenges of entrepreneurial uh, pursuit will be there, but you'd be suitably compensated. One can expect somewhere around 5 to 6 lakhs in the earlier stages, and once you have a positive word of mouth, this can only go higher. So that is also one of the avenues available for those who are thinking of entrepreneurship. Okay, I think I've touched upon all the uh, essential things that might be helpful in making a decision, a career choice. If at all I've left anything unaddressed, please feel free to send in your questions and I shall respond to them. Yeah. Thank you.